As we prepare for this week's P&G Gymnastics Championship, the focus is on elite athletes and their training. But even the best training doesn't make them or youngsters like your own immune to injuries. Hartford Hospital will be providing medical care to the gymnasts at the championships. And joining us this morning, a doctor who treats gymnasts, orthopedic surgeon Dr. Clifford Rios from Hartford Hospital. Thanks so much for being with us.
Thank you for having me.
Obviously, gymnastics, very, very physical sport. Let's talk about the most common injuries.
Yeah, you're absolutely correct. Gymnastics is a difficult and physically demanding sport, and so injuries are common. Most of these injuries tend to be more chronic and overuse type injuries from wear and tear of the long hours of training and not having adequate periods of rest. And some of those can be some tendonitis or bursitis or just joint pains, low back pains. The more acute injuries are the ones that you may witness, such as a fall or an awkward landing, and those can be sprains or bruises. Although with the increase in risky stunts, some more serious injuries such as traumatic head and neck injuries, fractures, or joint dislocations are a serious concern for athletes, coaches, and parents. Fortunately, most of those injuries are not catastrophic. However, they can be quite disabling.
Now, probably one of the most memorable injuries in the Olympics was in 1992. Carrie Strug, or excuse me, 96. She landed on one leg after suffering the injury. We do have some video, I think. There she is. She stuck the landing just one leg. I just can't imagine what an athlete is going through at that moment, and a lot of people are talking about the courage that she just persevered through it all.
Yeah, I think this is something that for the average person, we probably wouldn't make the landing at all. And I think in a venue such as an Olympic championship, the adrenaline, the emotion, the meaning of finishing the stunt, the athletes are trained to perform beyond the completion of the landing. And I think she knew that everything was on the line. If she landed, she had otherwise gold medal performance. If she fell, it was
could be devastating.
Yeah, devastating.
Right. So how can these injuries be prevented, either for Olympic athletes or things that parents should keep in mind when they have youngsters?
Yeah, that's the best way to treat an injury really is to prevent it. And so gymnastics is physically demanding. It requires tremendous skill and balance, strength, and agility. And so I think the first step is to make sure that you train with a coach who specializes in acrobatics and safety training. Other advice is to always practice in a designated area with something with pads, with mats, or a spring-loaded floor. An athlete should never practice on an unsupervised or without a trained spotter. The other thing that I see a lot in my own practice is there's a lot of pressure on young athletes to perform through pain. And I think it's critical that if an injury is, or if an athlete feels injured, that they listen to their body and they seek consultation either with their athletic trainer or with a physician who has experience treating athletes, because there can be some injuries which are minor sprains and can respond to rest. Others can signify a more serious injury that if identified early, we can prevent a more serious problem and get them back actually earlier.
And I have to imagine it's very important for parents to be in tune and to be very observant of what their kids are doing, because their children may not want to admit to the injury. They might say, oh, I'm fine, I'm fine, I'm fine, because they don't want to miss out. They don't want to miss, practice or the game or the competition. But the parents should take notes and stop them and say, I'm kind of noticing you're not walking quite right.
Yeah, the responsibility falls on the athlete, the trainer, the parents, and the coaches, and there's certainly a hope that one or more people involved in that process will intervene if they notice either a change in performance, either they're not running at the same speed or jumping at the same height. Any change in performance that seems awkward should really be interrogated further as to if there's certain types of pain or problems. Athletic trainers at this level actually are quite skilled in identifying abnormalities in the way that the athletes are performing and may help with that as well. But I think it's critical for parents to understand that these, especially young athletes, are under tremendous pressure. Their peers are performing. They don't want to be the one that doesn't make the team or doesn't make the show. And so it's very important that they intervene early so that we can evaluate them and guide a safe recovery.
Right. Better be safe than sorry, right?
For sure.
All right, Doctor. Thanks so much for being with us.
Thank you for having me.
I appreciate your time. Coming up next here on Morning Extra.